Welcome to the Gutsy Fertility Podcast, where health empowerment meets heartfelt conversations. I'm your host, Dr. Mandy Patterson, functional naturopath and fertility expert. Each episode of the Gutsy Fertility Podcast is a journey through the most pressing health topics of our times, viewed through the lens of functional naturopathy and emotional empowerment. So get ready to get gutsy with me as we hop into today's podcast topic. Hi, everyone. Welcome today to the Gutsy Fertility Podcast. We are so honored to have Dr. Susan Fox here today. She is a traditional Chinese medicine doctor, and we're going to be talking about her experience as a practitioner and how she helps women and couples on their fertility journey. Welcome, Dr. Susan.
Oh, thank you. Thank you, Dr. Mandy. It's so pleasant, so lovely to be here. My pleasure. Yeah.
I'm so excited about this talk. I've been thinking about it for weeks. So, all the things that we get to chat about today. So, I want you to chat with people about, as a Eastern doc, how you view the fertility journey and how you can help couples.
Sure. So, how I view the fertility journey is that it is just another life journey, right? We all have something that we're working through in life from day one to day end. And so I try to take the pathology out of the fertility journey, but use all of the Chinese medicine, functional medicine, that's also my background, to sort of really help a person identify what might be going sideways a little bit so that we can get her back into balance. I'm going to use the term her, just so I don't trip over my tongue saying her, they each time. Because I think that by the time someone has come to me, she's had a rough go. I'm not her first rodeo. And so she's, exhausted. Sometimes, just, despondent, a little mistrustful of, what have I got that's different that's going to help her. But where she also is determined, hopeful, because otherwise she wouldn't be, walking through my door. And that's where I like to, really meet her is at her level of hope, despite all of the things she's been through. I will certainly offer compassion. And this has happened. I've been in the fertility world almost by accident, because my first physical office happened to be across the hall from a fertility clinic, and it happened to be at the time when that Paulus protocol, I don't know if that name means anything to you, one of the first acupuncture protocols came forth. And so it was really almost grassroots driven, where women and couples, were doing the work themselves, saying, what else is out there? How else can I do this? And it certainly wasn't that the REI community at the time, the IVF community, was saying, I know, let's send you over to acupuncture. But thankfully, over the last 23 years, the fields have merged well enough, and the research has demonstrated statistically significantly enough that Chinese medicine and functional medicine and lifestyle changes and targeted blood flow through acupuncture, or acupoint stimulation is the term I use, makes a difference, and makes a difference such that a woman can, enjoy a positive clinical pregnancy and a live birth and a happy postpartum and happy baby mama.
Yeah, that's so cool. I love that. So what did you do before when your office was across the hall? I'd love to hear that.
Well, so before becoming a doctor of Chinese medicine, I was in the corporate world. I was,
Okay.
well, just before that, I was a mom, and had stopped the corporate world for a bit. But before that, I was in the corporate world. I did marketing for investment banking and for law firms.
Oh
So
my
very
goodness.
high level stress. We used to pride ourselves on, did we work all night? Did we sleep on the sofa? Did we get that proposal out, before our competitor, go home, shower, and do it all again? Needless to say, that's not a healthy lifestyle. I don't advise that for anyone.
No, no.
And it became apparent to me when I stopped work and had my own family, had my own daughter, that when it was time to go back, there was no question that was not a field that I could sustain. And I couldn't, in my heart of hearts, say I would go work in that environment, and then use my dollars to have someone else be taking care of my child in the pickup line,
Yeah,
hearing
right.
about her day. So that's when I pivoted to Chinese medicine, which had been a life-saving protocol for me when I was in my own teens, when it was
Okay.
brand new to the United States. So
Yeah.
in the 70s when dinosaurs roamed the planet.
Well, so how did it initially help you in your health? Because I think this is great for listeners to understand that journey. Like when we start very early with a holistic lens, like it can serve us so well as we journey into childbearing years and later in life. So talk about that.
Yes, I will, and I think it's going to pique your curiosity and entertainment because it has to do with the gut, right?
Okay.
Right, and so in my experience at the time, I was dealing with some severe gut issues, and at that time, at least it didn't come across my vernacular, and no doctor said the words to me, autoimmune. So I
Yep.
was being bounced back and forth between gastroenterology and psychiatry because nobody could find a reason for my symptoms and my suffering. And it
Sure.
was one of my hippie friends back in the day who said, "Would you like to try acupuncture?" And I was thinking, I will try Eye of Newt. I will try anything
Anything.
because I wanted to get out of this suffering. And in the very first session, I was able to viscerally experience the link between my grief at the time, and we were just having a conversation about grief and its linked to the lung and the large intestine,
Yep.
and the inflammation and suffering that literally holding on to, that I was not expressing grief. And so we won't go into all of the geeky, which I love, ramifications of how that affected my physiology, but it was absolutely correlated. My grief, my unwillingness or inability to let go of that grief, and my gut issues. And
Yeah.
as the Gutsy Fertility Podcast, um,
Yes.
as well, it all starts in the microbiome in our second
Yes.
brain. And so while mine wasn't fertility per se, it was definitely affecting every other area of my health and life. And had I been in my fertile, endeavor at the time, no doubt it would have adversely affected my
Well, how
fertility.
smart though for your mother or your mom. Is she the one that kind of helped you get, or was that
It
you
was a
solely?
friend. It was a
Okay, with a
friend.
friend.
It was a
Okay.
hippie friend. Mhm,
You did.
mhm.
So you say hippie. Yeah. Okay. Okay.
Uh-huh.
Yeah, because
Yep.
I even know just the difference, like in generations, right? Like what we've learned along the way. Because my mom grew when I was growing up had massive gut issues and
Mhm,
irritable bowel symptoms. She was diagnosed with fibromyalgia, then
mhm,
autoimmune
mhm.
Hashimoto's,
Oh,
thyroiditis.
mhm.
And, I just watched her suffering too. And she was part of the reason why I got into what I do because nobody could ever figure out like the root of her things. And then, like, now she's in her 60s and
Mhm.
has healed her gut and, really had a remarkable journey.
Beautiful.
And,
That's I love hearing that. Yeah.
yeah, there's hope, right? Which I love.
Absolutely. Our bodies want to heal.
Yes.
Our signs and symptoms and our diagnoses are examples of our bodies, kind of crying out that they want to heal. And so, the diagnosis isn't the thing itself. It's just describing what went sideways. And so we can just, peel back that onion layer and say, oh, that's what that's when I started feeling these symptoms. That's when I started noticing
Yep.
changes to my menstrual cycle, so on and so forth. Then we can, kind of start making those corrections.
And you're right. It's like, I always tell my people, I'm like, it's the body's whispers, right? And I love to say like more whisper because I lived in Australia, so that's how Aussies say whisper or whisper.
Well, I'm from
So
Massachusetts, and so we Bostonians would say whisper too.
yes, yeah, that's true. That's true. So, yeah, and like, even today I've been writing a chapter for a book and, just talking about how as a society we have always just tried to suppress symptoms, right? And that's our body's language to us. And so whenever we're shutting that down, it might temporarily fix the situation, but we're not getting to the root of what the issue is.
It will go from a
And
whisper to a cry to a scream,
yes.
in due time. Yes, for sure.
Amen.
Mhm.
So as you have gotten into the field and you've been doing this, you said 23 years, which is
Yes. Uh-huh.
incredible. I mean, I love it. It just makes my heart sing. How have you partnered with conventional docs like reproductive endocrinologists on the journey to support couples?
Yeah, gratefully, with tenacity and over time, I've just been able to help them help their patients. Right?
Yeah,
They've got their protocols, and I respect their protocols, and I am of the mindset that when someone is in cycle, I'm very respectful of the boundaries of that protocol. So there's no question what did what and where things might have gone awry. I'm not
sure.
introducing herbs at that point unless there's certain doctors with whom I have a professional friendship, and they'll say, no, no, keep the herbs going. I trust that
Okay.
you know. But if there's any question, I'm going to say, okay, this is where we can remove the supportive therapies, the supplements, the herbs, and so forth. And now we'll just go into cycle. So I think it's really just kind of over time and getting to know these doctors who are wonderful human beings who are in their field for the same reasons you and I are in our field. They want to provide the help that these women and couples are desperately seeking.
Yes.
It, I get a little, I'm going to just name it. I get a little pissed off when when I hear a conversation about division, about they're only in it for the money. They're doing 3 retrieval cycles because it makes more money for them. That couldn't be farther from the truth.
Yeah.
They 3 cycles because of our lifestyle, our environment, our what they're being presented with in terms of how many eggs they can get out. It tends to take 3 cycles, particularly if a woman has, diminished ovarian reserve. However, where
Yeah.
we can come in is to change the quality of
Yeah.
each egg that gets retrieved so that there's a better likelihood that that egg will become a healthy embryo and a viable pregnancy. So I
Yeah.
think that's kind of where we've been able to partner together, is that I can do things that they can't, or, shouldn't say they can't, but just in their protocols, that's not something that they are designed to do, but it helps them help their patients, and they help me help my patients, because
Yeah.
sometimes there is a need for an IVF or an ART intervention.
Yeah.
There could be a structural impediment. There could be a need for, if someone, and regrettably, has a cancer diagnosis, she's going to have those eggs retrieved pretty quickly so that she can get her treatment and then go back and have her family when she's healed. Same sex
Sure.
couples, there's so many reasons why IVF and egg freezing, because now women are coming out of the workforce, or coming
Yes.
into the workforce, knowing that they're going to need to put in X number of years for their own life experience, and so having those eggs sort of frozen and a security bank, if you will, is good for everybody. Then they're
Yeah,
not coming back at
absolutely.
age 40 thinking, oh goodness, why didn't I think of this then?
No, I love that. And I love the thought of like that team approach, because even, my partner, Dr. Jeannie Sheffley, we were discussing yesterday, like she was later in life having babies. She was an anesthesiologist, and her husband didn't get married until they were, I think it was 42. And she actually was able to get pregnant naturally at that point, and she had a healthy baby.
Beautiful.
But then got pregnant again, and she suffered a miscarriage,
Mm,
and they kept trying, and she ended up going the egg donor route. And so
mhm,
I just want to encourage our listeners not to have any shame around any way they're going about their fertility. As practitioners, I think you and I both can agree that we just want to support them, help them get
mhm,
as healthy as possible, and then
mhm.
look at the tools that we can use to help them get pregnant and have healthy pregnancies.
Absolutely. Absolutely. Yes. There's no right or wrong way to grow a family. It
Yeah.
is your way, and that your way is only the right way. And if anyone's going to tell you differently, they're not your person.
Exactly. So, this is kind of a high level overview question that I wanted to see if you could impart to listeners. But, like, from an herbal standpoint, and even like the management of stress as they kind of go about their fertility journey, what would be like some tips that you could offer them as they, as, or, if they would decide to work with a practitioner, like what to look for as far as like a holistic plan.
So I'm going to intentionally not answer the question about herbal medicine because
Yep.
herbal medicine is a customized medicine.
Yep.
So what I will say about it is don't just go take any herbal medicine because herbs are medicinal, and if you're taking the wrong medicine, whether it be herbal medicine or a prescription medicine, you might find yourself having to unravel that little ball of mess.
Yes.
So but certainly what I would say is look at your lifestyle. Look at your menstrual cycle. Is it regular? If it's not regular, how is it not regular? Is it are you having a period every 3 to 4 months? Then come, let's get some simple blood work will
Yes.
help us ascertain whether or not there's a reason. We would typically look for a polycystic ovarian
Hmm.
situation, or a diminished ovarian reserve situation. And then there within whatever that diagnosis is, again, you and I had mentioned that the diagnosis is not the end thing, it is describing the beginning thing that went
Sure.
sideways. We then put in protocols, lifestyle protocols. I try to do as much as I can in lifestyle recommendation rather than
Yes.
say come in for X number of treatments. There are protocols in the IVF journey that would say that the research uses X number of protocols. And so I would say I'm going to duplicate those protocols because I want to give you what I know has proven to be true. But what I'm going to do in the treatment room is not better than, and is not a replacement for what you can do every day in your own home.
And I
And
love you. I love how you say that because, like, really, we're kind of on different sides of the track as far as like the Eastern Western medicine. Although, like I said, I've trained in body intuitive, in some of those, so I have deep understanding into it. But I think just emphasizing to couples and women that it really is a bio individual thing, and we're all different and we all have different needs. And so that's where, like, having some blood work to look at with a trained practitioner that can help you kind of decode some of that, can be really, really valuable. And how us as practitioners can sometimes get off into the weeds, and where like functional medicine tools can become like green pharma, right? Where we're just taking, I'll have some couples come in, they're taking like 20 supplements because
oh
they read a
goodness,
book and they
right,
heard inositol and they heard all of these other things can benefit them. But in reality, it really does go back to those fundamental pieces of health that are very easy to, like, pull some levers to help
right, right.
optimize
If
health.
she's not digesting that inositol, she's making very expensive urine, right? So
Exactly. Yes.
So,
Yes.
so yeah, so yes, I would say there are a couple of tips that I'd like to give the listening audience, and that is if you want to work with a fertility specialist acupuncturist, there is an international group called the Acupuncture and TCM Board of Reproductive Medicine, aborm.org. And
Okay.
that will list people who have gone through a series of tests, board certified testing that demonstrates we have a working knowledge of the fertility journey and how we can best support.
Okay.
I regrettably, and I think this is not exclusive to my industry, there are folks who just decide they want to be a fertility specialist, so they claim themselves to be a fertility specialist, and they're wasting some precious time for the couple who needs attention and needs the right attention now.
Yeah, I think that's a very good point.
Yeah. Yeah. So aborm.org. And then I would also say that, you know, as a licensed provider in the state of California, I cannot prescribe outside. I can't, I'm limited to this, state boundaries of my license, but I am also a health and wellness certified coach. So for someone who's not in my state, I can give um, support, right? I
Yes.
can't give a diagnosis and treatment plan, but I can give support and direction as to where they might go. And I
Yeah.
do have an online course that helps with some of these sort of general protocols that have been remarkable. I mean, they blow my mind to
Nice.
know how well they can work. So you
Okay,
don't
that's
need.
great.
Yeah, yeah. I'll give those to you that they can go in the show notes if anybody's of interest.
Yeah, absolutely. I think that's
Mhm.
great. I know locally I have a friend who was a nurse practitioner and she went back and became an acupuncturist. And so locally, like I
Mhm.
refer in Indiana out to her and they will go see her for acupuncture. And I love that because I really think when we can bring all of us together in supporting people on their wellness journey, that's where we actually get, the results. So
Absolutely. And we want much more than the positive pregnancy test, right? We want a healthy pregnancy. We want a healthy baby. We want a healthy postpartum mama, healthy family. And the changes that you and I are helping, a woman and couples to go through now is going to support all of that, right? Those changes are going to show up at the dinner table, show up at the walks outdoors afterwards, the waking at this, at the right time, the getting
yeah,
off the screens at the right time, all of these lifestyle changes that are seemingly simple, but we don't do them.
it's
So
so
they're
true. So true. And like that's where I even with my women that do work, talking about like setting a timer on your phone like every 50 minutes. Get up, go for a walk because we know that inactivity has actually become one of the biggest contributors to disease and dysfunction in the body. So,
Mhm.
yeah, I really
Well,
love
they say
that.
sitting is the new smoking. Is that the
Yes.
phrase? Right. Uh-huh.
Yeah. Right.
Yeah.
Which is why I have a standing desk here. Cause
Likewise, I'm standing as well.
yeah, I love it. I love it. And, I think you really hit the nail on the head when you were kind of talking about starting with couples really early on and getting them to recognize, even from a preconception planning side of things, you
Mhm.
want to start at least 3 to 4 months in making and getting those lifestyle changes into place before
Mhm.
you're even thinking about getting pregnant. And unfortunately, as a society, we're always like, we want something right now, like lickety split, and the importance of that, because from an intergenerational side of things, and this is part of my own program, is starting with the mama and like really working on her health, because what happens is like when she gets pregnant and say it's a female, like that baby already has eggs, so like that mama is nurturing her grandkids, which I just love
Absolutely.
that
I
idea
agree. Yep, that
you
it's
know
and yeah, I mean more than an idea, it's a reality. And it's it takes us back to the sort of the magical mystery of life. We can know all we know in the world of medicine and science, but all we know is describing what already existed. We have
Amen.
found a way to prove what already existed. And so I find that to be uh, humorous and appropriately humbling.
Yeah, and I that's
Mhm.
exactly what I was going to say is the humbling
Mhm.
piece, because even as practitioners, even though we have years of experience in training, I always like I've been humbled so many times that it just starts with simply a beginner's mind. And
Mhm.
I know you and I had this conversation earlier as like, we're diagnostically like, let us see the labs, let us look at the test and like all of those things. But then taking a step back and say, how are you today? Like,
Right,
how has your day been?
right, right. What is
And
on your mind today? Yes, yeah.
yeah,
And all of these other pieces are important data points, but that's what they are. They're data points. They're giving us a little bit of a roadmap, but we are not living inside your body. So if we're giving you all of these lab results, that's just a fraction,
yeah,
of what you intuitively and innately know, if you're giving yourself the permission to go inside, take a minute, kind of self-assess, how am I today?
yeah,
How was my cycle this month? What did that mean to me? What did I notice? Like, you
right.
are the driver of your bus. So we
Oh, I
just want.
love that.
Mhm,
That's a
mhm,
good one. So,
mhm.
like, after 23 years of experience, you have tremendous insight into this journey for women and
Yeah,
couples, right?
yeah.
So, what would you see are some of the biggest deterrents that are things that we're missing, like
Mhm,
as healthcare
mhm.
professionals and as, like, just humans trying to navigate life and trying to be healthy? What do you see?
Yeah, I think I would say that what I notice is that there is a presumption, and I think we had this conversation before. We're trained that if we do this, we get that. If
Yes.
we do this educational series of courses, we get that degree. If we get that degree, we get that position. If we get that position, we and do well, then we get a higher position or get hired away. We are in this conversation, not living in that paradigm. There is not an equal sign to if we do this, we get that. But there is a requirement that we do this in order to get that. So there really is the biggest learning that I notice with patients, and I'll use the term patients because I'm referring to those who come into my office,
Yep.
is that awareness of, oh my goodness, first of all, I didn't even know about my own body. I've spent my entire life trying not to get pregnant and
Yep.
didn't know what happens in my own body. I know all of these other things. I can run a multinational company and I don't know my own follicular genesis phase,
Yes.
right?
Yep.
I don't know how to, notice that fertile cervical mucus is an indicator that this might be a good time to, say let's go have a date night.
Yes. Right.
Right? So it's almost comical, right? But it's tragic that we are have been discouraged from learning about, especially as women, about or female bodies, about learning about our own body.
Yeah.
um, it's we learn, we know everything else. We know how to brush and floss our teeth. We know all about that what is a good bedtime and what we should eat and what we shouldn't eat, and we don't know these very fundamental and important components of our own hormonal activity.
I so agree with that. And, even, I mean, just looking across the board, our educational system, like our kids have health classes and all of these things, but I just feel like it's largely unaddressed. And, like, even as a young kid growing up, I'll never forget, like, starting my period when I was 9 years old, which was rather early back then, right? In the
Mhm.
80s. And I just had so much shame about it. And I didn't talk to my mom. I spent 6 months trying to hide it from my mom. And I'm like, that is not what I want for my kids and my grandkids. Like, that is it's a sacred thing to be able to have a period and to be able to cycle and to have children. And it's such a blessing. Like, and it's something that's been largely there's some shame
And
around it. And
we know why. We know it, we won't go into that sort of the patriarchal political bent, but we do need to, as women, as people who bear children, we need to like demand to that we reclaim the importance of how we as reproducing beings function in the world.
yeah,
Like we have a right to be giving ourselves a little downtime, or maybe not be on the lacrosse field when we're just on our first day of our period, because that's a setup for endometriosis down the road.
yep,
These things that we just have a right to be functioning naturally through
yeah,
our menstrual cycles from the very first day and before that day we get our first period.
absolutely. So I know we're getting close to ending our time, and I want to respect your time today. If there is like a couple tips or pearls of wisdom you could offer to the listeners as
Mhm.
they might have are just starting out on their journey, or maybe they've been in the trenches and they've been working with reproductive endocrinologists and doing assisted, reproductive technology, would be some things you would offer to them?
Sure. Well, it's a slightly different for either of those groups, right? My first comment would be get tested. Like,
Yeah,
test, don't guess. Like, and especially if there are signs and symptoms that say something might be a little bit sideways. If you are, just graduating college, getting your first job, see if your company is offering, that kind of testing so that you know what to expect, so that you're not behind the eight ball.
yeah,
If you're already down that journey and you're struggling, I would say get to a professional,
yeah,
because don't use Dr. Google, don't use some of the general, group think tanks out there, because on Facebook or whatever, or
yeah,
social media, because you may be getting all of the misinformation that just leads you a little bit further astray. Really,
yeah.
rely on the knowledge of a professional who's trained and educated. But then, as importantly, remember you're driving the bus. We work for you.
Absolutely. And just a clarifying question, because this popped up for me, because I know not everybody's as versed in it as us in like the medical arena. But when you say test, what would you say for them they would need to look out for?
Sure. So the first basic, hormonal blood tests would be an AMH, anti-Müllerian hormone,
Yep.
and then I like to pair that with an FSH and estradiol on cycle day 2 or 3. So I'm looking at two sides of the same coin,
Yes.
because if there's a discrepancy, I know that there tends to be a fascination now, if you will, or a reliance on AMH over FSH and estradiol,
Yes.
but we miss something. If,
Yep.
for instance, estradiol is elevated in the beginning of the cycle, we may not see that in an AMH level. So that's
Yes.
the first one, an AMH and a cycle day 2 FSH estradiol.
Yep.
And then in that same cycle, I try to ask that it be in the same cycle, 7 days post ovulation, typically at or after cycle day 21, a progesterone and an estradiol as well, because we
Yes.
want to see how did those eggs growing perform in secreting estrogen to grow a uterine lining.
Yep. Yep.
Then I would say overall, that can be taken at any time in the cycle, or some of the basic tests that will demonstrate that mama's body is ready to hold a pregnancy. And that is,
Mhm.
what are her vitamin D levels? Does she have autoimmunity? And it's very common, especially for a woman with what we call secondary infertility,
Yes.
to have, Hashimoto's, an autoimmune thyroid condition. And that fluctuation in the thyroid levels can be a setup for a miscarriage. So
Yep.
that would be any time in the cycle, and that's not typically done. You might have to push for that.
Yes.
And then iron and ferritin, because we tend to go a little bit anemic in our early in our during our pregnancies. And if you're starting out anemic, then you're going to have a little bit more trouble holding a pregnancy. So those are
Yeah.
those are kind of just some basics. And of course, then they'll do the CBC, and
Yes.
if you're in the reproductive endocrinology world, they'll do further testing. But I would say, don't miss out on those 3 sets of tests,
Yeah.
because I think they're important.
That's great. That's great. I agree with you wholeheartedly. So those are
Yeah.
a lot of the ones I recommend as well. So, well, it has been great having you on here. Can you please just share with the listeners on how they can reach out to you or find your course? That would be great.
Absolutely, absolutely. So there are three URLs, and because I like to start, being a Chinese medicine practitioner, I like to start with, what is your 5 element type? So there is a yourfertilityquiz.com,
Okay.
and that will help you to go through a little quiz that identifies your 5 element type, and that will give you some sort of free tips and tricks about
Yep.
your element type and how it relates to your fertility. Then the course is at healthuniversity.co, and Health University is spelled YOU, health
Okay.
YOU university.co,
Yep.
within which you'll see the program page for the Your Fertile Health course. So, and then if you're in California, in the San Francisco Bay Area, and would like to see me personally, that's drsusanfox.com. All of these, of course, are linked
Yep.
because World Wide Web. So
Exactly.
anyone can get you to the rest of them.
Well, it was great having you on, Dr. Susan. It's been such an honor and pleasure. And I can't wait for the
Mine
listeners
as
to hear
well.
all of this.
Thank you so very much. It's my delight to be here, Mandy.
You made it to the end of the episode. Let's keep this Gutsy Fertility Party going with some next steps to empower you along your wellness journey.